Even before the pandemic, mental health was one of the hardest areas of community need to address. The anxiety and stress of the past few years has taken a heavy toll on all of us. Everything begins with stigma, and forever, mental health has been associated with stigma. And that's the very first barrier that we need to break down. And there's a variety of ways that organizations are going about trying to do that. But that is the number one impediment to individuals seeking treatment.
Mental health is one of the key strategies that we've been focused on that's taken on particular importance as we've come out of the pandemic. All of us, our families, our coworkers, our neighbors, have realized the impact that mental health has on all of us, regardless of socioeconomic status, where we live within the community. This is an issue that's affecting everyone. And it is exacerbated when you add in the intersectionality of issues like race and gender, sexuality. All of these things play into an issue that we've decided is one of the key focus areas for us in the coming years.
So what we're seeing in the nonprofit sector is a lack of workforce and agencies struggling to identify and retain quality staff, which has a direct impact on the people that we serve. If our agencies don't have staff to be able to provide these services, then people cannot access them, and that's another barrier to them receiving care.
Well, I will tell you that there has never been a time that's been so difficult, because basically we're looking at vacancy rates in the neighborhood of 20% or more, both at NCSS and with many other providers. This is unprecedented.
There are not enough mental health care providers in our community to support the people that need the help. And so we've got to do something in working with our partners to address that.
So the United Way in that way works as a convener through the mental health initiative to bring together stakeholders and experts in these areas and provide a facilitated and supportive space for people to come together and brainstorm, problem solve, identify strategies, and then work to implement and evaluate them.
Together, united,
we can strengthen mental health services for ourselves and our neighbors.
Join us.
Give.
Advocate
Volunteer
in your community.